Hello, I'm Donna Rodriguez. Welcome to the Pembroke Board of Health candidate interview. I want to take a moment to thank our candidate for participating in this interview and collaborating with PAC TV to bring this informational programming to residents and voters this election season. Let me explain the format. We will be conducting a one-on-one interview-style Q&A format with each candidate, lasting about 30 minutes. Responses will not be timed, and follow-up questions may be asked during this format. We aim to ask up to 4 questions, but that will depend on the length of the responses, along with any follow-up discussion during this exchange. Candidates will be allowed to address anything not covered or that they would like to add clarification to at the end of the interview in their closing remarks. Let's get started. Today we're speaking with Maureen Jasie, one of the 2 candidates for the Pembroke Board of Health in the Pembroke Town election. Maureen, thanks for joining us today.
Thanks for having me, Donna.
We're glad you're able to be a part of this. And why don't we just dive right in with the first question. Given where we are now from where we were 2 years ago at the start of a global pandemic, do you think there's a bigger light shining on the Board of Health and what it does? And how do you think that would impact how the Board of Health works?
Thank you for the question. And if I might just take a moment to say thank you, Pembroke, for having me. Thank you, PAC TV, for giving me this opportunity to speak with you and let the people of Pembroke know a little bit more about me and introduce me as well. In regards to the question that you asked me, I believe that the Board of Health definitely has come into the spotlight with the pandemic. It's a very complex board, and the department reflects complex services that it provides to the town, a large range. And I believe that the people of Pembroke, including myself, have drastically become aware of the importance of the Board of Health and how much it really does service our community and work to protect us in many different ways. Myself, that is basically why I'm here tonight, is the pandemic has caused me to want to become more engaged and involved in my local politics. So I'm hoping that a result of the pandemic is that the community becomes more aware of the importance of each of us becoming engaged, aware, educated, informed of our local government and what it's doing and how it's affecting our lives and it to better serve us, the people of Pembroke.
Thank you. Now, what do you think are the 3 priorities that the Board of Health should be working on moving forward that maybe aren't related to the pandemic?
Yes, thank you. Well, the Board of Health, as I was saying, has many, many roles. I believe that right now, as we're coming out of the pandemic phase, that social, emotional, mental health is a very a part of health that should maybe take a more prominent role with the board right now. Might be some kind of initiatives that we can make to support, for instance, the schools. They're struggling right now with trying to assist children with coming back to speed with anxiety and different anxiety, social, emotional things that they have experienced, as well as adults in the community as well. So I feel as though the Board of Health could be very active or more active in some kind of initiatives to deal with the social anxiety, depression, isolation, all of these repercussions that we are all experiencing. I think that would be a good thing to maybe focus on at this time.
In addition to social, emotional, and mental health issues, what are 2 of the other priorities that you think should be important to the Board of Health moving forward?
Yeah, thank you. You did ask me for 3. I apologize. Another initiative that could be done would be to increase the access to preventative care clinics, such as diabetes. Obesity is another chronic issue in our community as a whole, not just Pembroke, but just in general in our country. So different preventative clinics that aren't quite costly, that would increase education and information. Diabetes is one thing, obesity. We do hold flu clinics. But that's something that I think that we could be a little bit more active in, that again isn't cost effective and going to hurt the budget. So preventative. Also, I believe that the board will be actively involved with a lot of growth that's coming towards Pembroke. I know that from attending different meetings that there is, because we're adjacent to the train, we do need to put in some kind of mixed low-income housing and so forth, and that is on the forefront of our community. So that will be also something active that the board works with, I would expect, going forward in the future.
Thank you. Given those priorities and also the fact that you're running, what is your vision for your role on the board, and how do you think you could be most effective in that role for the board?
So I don't come to the board with an agenda. I want to be more involved and engaged. I plan to do a deep dive if I can, just become educated, ask questions, see why we're doing things, if there's a better way we can do something, or be more efficient. I believe that the Board of Health currently works, they work very hard. They do a wonderful job servicing our community. And at the moment, I'm not identifying something that is lacking or so forth, but I do wish to get involved and engaged, and I think sitting on the board would be a wonderful opportunity for me to do that. I do have some life experience that I think would help me be successful.
Now, what do you see, just looking at this a little closer, what do you see as, what do you specifically bring to the board and bring to the group of people that will be working with the community? Whether it be your strengths or something about your personality, what do you see that would positively impact the board's work?
Health has always been something that has kind of circled around my life. It's something of passion, or something that I enjoy. I started as a candy striper at St. Margaret's Maternity Hospital in Dorchester as a young girl, with my first interaction with the health system. I earned my bachelor's degree in healthcare administration. I've studied policy of health. I've also achieved a certificate with paralegal studies, so I'm familiar with policy and law. I went to graduate school and got my master's at Suffolk in public administration. I'm familiar with town government structures, how they work, and how they service the community. I also worked for a time as a medical clinical consultant for a medical healthcare company, and worked with clinical occupations in the hospital and the health. In schooling, I also worked with infection control nurse at Quincy Hospital, doing rounds, looking for infection, things that would cause high risk for infections in the health setting. Also worked as an assistant in the occupational health department at Quincy Hospital for a time. I've also found myself working in the customer service role for a telecommunication company for the last 23 years, helping service small business owners and their networks. I've also served in the capacity of a union steward. I'm a member of the IBEW union, and I've worked serving as an advocate for my fellow members, as a steward, with labor questions or any kind of grievances, or to voice for them and to be somebody who will advocate in that kind of a situation. These are some things that I have experience with, that I feel as though my ability to ask questions and to learn and to look at things will be helpful on the board. And that's what I have to offer and to bring to it, to serve the people of Pembroke.
Thank you. Now, the physical impacts of COVID-19 are something that are tangible, that can be seen, and that people can identify and hopefully treat. But as you mentioned earlier, talking about mental health issues, the mental impact as a result of COVID is more difficult to assess, especially the impacts for our younger population. What are some of the steps or programs that you would like to see implemented in order to identify and then address the mental and emotional impact of the pandemic?
I believe that completely agree with you that the social and emotional impact to the children of this community is evident in the recent budget review with the school committee, and that was recently last night presented to the select board. The 5 principals over the last month have presented to the school committee their requests, their top priorities, and they all revolve around the social, emotional well-being of the children in our school. I believe the statistic that I heard was that the need for support in the schools has increased 110%. That's extremely concerning to me. As far as how to go about tackling that concern, I know that the school is making, I believe that that money budget that they have requested is going to pass and be approved. That hopefully will be effective in helping the children move forward and healing with anything that they need to have healed. And move forward.
Do you see ways that the Board of Health might be able to collaborate in developing programs or supporting the schools in that work?
I would love to entertain a conversation with these psychologist staffing at the school if they would be so willing to do so. I'm sure they are flat out actually. Just another thing is that a problem that we're facing is the lack of emotional resources to even assist people. There's a wait list. There's just a lack of support. So I don't know what the answer is. I am open to suggestions. I do acknowledge that there's a problem and there is a need, and I would like to be engaged with other professionals who are more equipped from the mental perspective to provide solutions. I'm more than willing to partner with them and do whatever we can at the Board of Health to collaborate and move forward and do anything we can to support and help our children and have a full, healthy, happy childhood.
Thank you. Our next question, our bonus question. Communication from any town board or committee is key in keeping residents informed and up to date on issues of concern to them. What do you see as the best ways for the Board of Health to communicate with residents in an effective and timely manner?
Well, thankfully, in this day and age, we have social media and in websites, and it has made communication and the speed of communication very more faster. However, government, doesn't catch up with those things as quickly. The town website is very, very helpful. However, I think there are times when it can be a little bit more up to date. Maybe there could be some initiative or a responsibility. Not that I'm looking to make or create responsibilities already for a Board of Health department that is already dealing with an increase of work due to the needs that have been created because of the pandemic. But thank you.
Thank you. Now, we want to give you a couple of minutes for closing remarks or to address anything that might not have been brought up yet that you'd like the viewers to hear and the voters to hear.
Thank you. Again, I just want to say thank you so much to PAC TV for giving me this opportunity, and you, Donna. I wish to serve the community of Pembroke. I don't have an agenda. I wish to be engaged at a local level, to ask questions, to see why things are done the way they are. If they're being effective in giving good results, then let it stay. But if I identify things that can be improved, I'd be willing to do so. Town government is very complex as far as back to the communication, and you need to be willing to work, listen, communicate, ask questions, and be committed. And if the people of Pembroke should elect me on May 14th for the Board of Health, you have my commitment to you that I will take the time to ask questions, learn what's going on in the Board of Health, and identify solutions, work with people, reach out to other departments, whether it be within our town, other surrounding communities, or the state. Anything we have to do, I will keep following the trail, if you will, to get what we need to get. And again, thank you for your time, for listening to this interview, and I appreciate your consideration and your thought in contemplating electing me as your next Board of Health member for the town of Pembroke. Thank you.
Thank you, Maureen, for your time and for participating in this interview. We wish you the best of luck throughout your campaign and in the election. And for our viewers, thank you for joining us. If you're interested in watching replays of this interview, please visit our website, pactv.org/elections, for replay times and online viewing options, including PacTV's on-demand and streaming service, PacTV Prime. And please make your choices heard by voting in the election on Saturday, May 14th. Thank you and good day.